Hello, everybody. My name is Dr. Z, and this is Dr. Z's Corner. Welcome to our very first episode, and today we're talking about consultation day. Yeah. So basically, this is just the patient's role in a normal doctor-patient consultation, right? So just picture this. It's a Tuesday afternoon. You're not feeling too well. You're feeling sick. Your body is hot. You're running a temperature. And you just say, okay, let me just sit a while, let my immune system do its thing, I'll get better in a few hours. It's Friday, you're not still better. Saturday, you're getting worse. The normal Nigerian mentality. So just stroll to nearby chemists or pharmacy, get one or two things. They gave me this and they gave me that. You use it, right? You use it on Saturday afternoon, Saturday night. You're not still getting better. You're like, hey, what's going on? Let's check out Sunday. You use it on Sunday, still you're not better. You now finally decide to go to the hospital on Monday. What you should have done on the very first day. Catch yourself. You know what I'm talking about. It is you. Anywho, let's go to the hospital. Now, many a times I hear patients say they don't like going to the hospital for different reasons. And some of these reasons I've collated them and I want to talk you out of them. How can you have a small consultation day? Now listen it. Three things I'll speak into today. One, how to deal with the waiting period. Two, be ready to give information, right? Give information to your doctor. We're here to help you. And three, how to have the best outcome. So follow me on this journey. Now, waiting period. I mean, people have to wait on many things. You have to wait for that call from that friend that you like so much. You have to wait for the food that you order from place or somewhere else. You have to wait for your spouse. You have to wait. People wait a lot, and waiting is not really fun. It can be very annoying. Now there are certain times in the hospital where you get to wait. For instance, you wait to see doctor. You wait to get your blood drawn for investigation. You wait to get the result of investigation. You wait to get your medication from the pharmacy. They're all included into waiting periods. That makes sense at the end of the day because you don't expect us to see you in a jiffy, collect your sample in a jiffy, but it doesn't work that way. So there are little waiting periods that you cannot avoid. But how do you go through this waiting period without making it so frustrating? There are certain things that you can do. Disclaimer, this is not for emergency situations. I'm not talking about someone that is bleeding actively or someone that just had a car accident or someone. No, this is just a normal walk-in consultation, okay? So you don't have to wait when it's an emergency situation. Even the doctors will not wait on you, all right? So let's move on. What can we do in that waiting period? I picked up a few things over the years as a doctor, and these are some of them. Number one, come with somebody, come with a friend or a family member for support and also for gisting. So you're done seeing the doctor, they collect your blood, you're waiting at the reception. You can talk to this person, can gist about something, person can be there for support. I mean, you're here in the hospital, you're not feeling fine. So it's really good to have somebody, that can wait with you. So you're not bored. That's number one. Number two, you can come with your phone. You can watch football highlights for those guys that like football. You can watch an anime for the anime fans. You can see a movie. You can read a book, people that like to read books on their phone, or you can have a real hard copy paper. Read something. It can also help with the eating time. Another thing, I've noticed that some people, even though they are sick, they are workaholics to the core. They come with their laptops to the hospital. So during this waiting time, they attend meetings, they type something, they are always with their laptop. I don't recommend that so because you're sick, you also rest your brain and things, but they still do it. And it's okay just to make the waiting time bearable. So those are some of the few things I think, can help you during your waiting time. Moving on, the information ready. Remember, we're trying to have you have a smooth consultation day. Yeah. So the information ready. Many of my patients, they tend to, sometimes not give out all the information and they see some of the questions that we ask as doctors as irrelevant. And I'm like, not really. Now we need all this information to help you in the best way possible. We're like detectives, okay? Yeah, we ask a lot of questions. Things that you might think are irrelevant, but they will actually really help us. Like your past medical history, like your past surgical history. Have you had a surgery before? What medications are you on? What medication did you get from the pharmacy when you went, 2 days ago? Remember the story? Yeah, that is very important to us. Um, do you drink alcohol? Do you smoke? It's important to us. Why? These things help us to help you at the end of the day. So if you don't tell all of this information or you lie to us, at the end of the day, you will be doing yourself a disservice because we will not be able to give you the best management possible. And that's not good. Okay, so please be information ready. Tell us all we need to know so we could help you in the best way possible. We're here to help you, so let us help you, okay? Yeah. So that's that. Yes. Best outcome. So what do I mean when I say best outcome? Um, I mean that. So basically, my patients, I hear some of them say, "Oh, I don't really like taking injections, or I don't really like taking medications. Is there nothing else that can be done?" Well, there are different therapies, there are different management plans. Okay, it can be oral medications, it can be surgical intervention, it can be therapy, right? Whether it be physiotherapy or behavioral therapy for mental health cases. Okay, but if your doctor gives you a particular preference and tells you that okay, using medication is what's going to work for this particular condition, then you take the person's word for it. And how, like, for this episode, I'll be speaking to that in particular. What do I mean? Now, you're supposed to take oral medications, right? And you're supposed to use it for 3 days, okay? But you use it for a day and a half and you feel okay already. You don't feel the need to complete the course. Well, that's not good. That's not good enough. You have to use exactly how it's being prescribed. That's how you get the best outcome. Because if you don't, you'll see that maybe in a week or two, you're back with the same symptom. And it's because you do not follow the correct management plan. So please, these are the points. And they are not hard at all. For your waiting time to be less annoying, bring a partner, bring a book, watch a movie, do something, do work. What makes you happy, okay? Just to make the waiting time a little bit bearable, okay? Next thing, be information ready. Be ready to give out your information to your doctor. Be sworn oath, you're confidential with your business. So you won't hear it somewhere else, okay? You can trust us on that. To help us help you. And then let's have the best outcome possible, okay? What do I mean? We give you a medication or a management care plan. Please follow suit, okay? Yeah. And that's all for this episode. And that's how you have a very smooth consultation day. So please remember to like, share, and subscribe. Stay healthy, true, and beautiful. Bye.